And our next story is from India. It is witnessing an uptick in the Wuhan virus cases. Should this spike worry you? What is behind the growing infections? Is another wave of the virus on the horizon? Over the next few minutes, we discuss this and more. Let me directly start off with the numbers, of course. In the last 24 hours, India has recorded over 4,435 fresh COVID-19 cases. This is the highest single-day rise in the last 163 days. And during the same period, a total of 15 deaths have been reported. This is according to data from the Union Health Ministry. Where have the deaths been reported? 4 deaths each have been reported in Kerala and Maharashtra, 1 death each in New Delhi, Haryana, Rajasthan, Gujarat, Chhattisgarh, Karnataka, and Puducherry. Now, on the positive side, the active cases in the country right now comprising just 0.05% of the total infections. And what's more, a total of 2,508 recoveries have also been reported in the same period. And if I speak of the recovery rate, it stands at an impressive 98.76%. And as for the fatality rate, it stands at just 1.19%. But that does not mean we let our guard down and give in to complacency. This is the message, by and large, by the health authorities. A message that is not really going unnoticed. Have a look at this report. Amid the rising COVID-19 cases, the Supreme Court of India has told lawyers that they can appear virtually for the hearings. This decision has been taken by the Chief Justice of India himself, D.Y. Chandrachud. He says the court is willing to hear lawyers via video conferencing. And if they want, they can also work in hybrid mode. If I speak of preparedness, the government of India is not taking any chances. It plans to hold countrywide mock drills next week. Reports say both public and private health facilities in all the districts are likely to take part in the exercise. The aim will be to assess the availability of the medicines, hospital beds, medical equipment, medical oxygen. If I speak of the kind of people falling sick in Delhi hospitals, most COVID-19 patients are either elderly or people who have comorbidities. This is according to the state health department officials. It says that a majority of the patients are above 60 years of age and have been suffering from issues like cardiac disease, kidney disease, diabetes. And this has led to warnings from the health experts that those with comorbidities need to be particularly cautious. They say comorbidities weaken the immune system, making it difficult to fight off respiratory infections. And it doesn't end there. A new study has also been released. It says COVID-19 infection has the ability to accelerate the progression of dementia in patients who already have the neurodegenerative disease. And according to another study, a widely used clinical drug for controlling type 2 diabetes can lower the chances of being detected with long COVID. The name of the drug is metformin. A Lancet study saying that treatment with metformin during COVID-19 infection prevented over 40% of the patients from having long COVID. And as for the spike in cases in India, yes, the numbers may be growing, but health experts say it's too early to be alarmed. It's too early to say if lockdowns and restrictions should return. For now, prevention remains our best bet. WION now available in your country. Download the app now. Get all the updates on the move.